Hello, and welcome to Rock Your Block. I'm Tia Young, your host. Our special guests today are Dr. David Goldberg of David Goldberg and Associates, and Dr. Alexander Melamud of the Retinal Group of Washington. Both of the doctors have offices in the Washington, D.C. area as well as in Virginia. Just to give you a little backdrop, about a month and a half ago, while working late at the office, I started to see spider web-like floaters and a couple of bright lights. I didn't feel any pain, but just like any good old American gal, I took a couple of aspirins and got a glass of water, and I thought, you know, maybe I've been working too hard and I need to go home. The floaters continued through the night and into the next morning, and I began to get a little concerned. So I contacted Dr. Goldberg, who has been my optometrist since 1979, and requested an appointment. Was that ever a good decision on my part, as you will later learn? But for right now, let me introduce our special guest to you today, and I'd like to say welcome to Dr. David Goldberg.
Thank you.
Hello, how are you today?
Oh, I'm doing well, thank you.
Thank you both for coming, and Dr. Alexander Melamud. How are you?
Thank you for having me.
Thank you so much. I have a lot of questions today, and we probably won't get to all of them because I see some really interesting things here, so I'm probably going to cut some of my questioning short, just so you guys get a chance to talk. But if you could start out by telling us a little bit about your practice and about all those letters behind your names. I don't know what they mean. So let's start with Dr. Goldberg first.
Sure. I'm an optometrist. That's what the OD stands for. Okay. I've been in practice since 1978 when I graduated. I've been in Alexandria for the past 34 years. And we have a general practice where we see patients of basically any age, any problems, and we do comprehensive eye exams, take a look at their eyes, make sure they're healthy, number one. Fortunately, most patients have healthy eyes. And then the main concentration becomes how to correct their vision, whether it's through eyeglasses, contact lenses, or even LASIK surgery. And that's really our area of expertise, where we will help them decide, see what's best for them. Eyeglasses and contact lenses sound relatively simple, but in fact, it can be pretty challenging. There are many patients who struggle getting the right eyeglasses, patients who are in front of the computer for most of the day, and we pride ourselves on being able to help the challenging ones. We have a lot of experience. I've been doing it a long time, and I'm fortunate to have a staff where we have 3 people who have been with us for 30 years.
Wow.
So there's a lot of experience and a lot of know-how. And recently we've added an optometrist named Robert Stediclew, who's been in practice for over 25 years in Ballston and Arlington, and we're very happy to have him. Now, if patients have problems and we see things that are beyond our area of expertise, like what happened to you, then we fortunately have good relationships with all these wonderful specialists in the area, such as the Retina Group.
Very good. Okay, Dr. Melamud, what about you?
I am a MD, a medical doctor, and I specialize in ophthalmology. I've been a medical doctor for the past 13 years and an ophthalmologist for the past 8 years, and specializing in retina for the past 6 years with the Retina Group of Washington. And you know, my passion and my work is probably the smallest part of the body, which is not just the eye, but the little part of the eye that's the back part of the eye called the retina. And I can explain a little bit more about that. I'm part of the Retina Group of Washington, which is actually in Washington, D.C. It is a group of 23 retina specialists, and we have grown over the past few years to be the largest group in the country of retina specialists. And we provide the state-of-the-art care in medical management and surgical management of diseases of the retina.
Right, right. Well, folks, I have to tell you that, as I said earlier, I made an appointment to go and see Dr. Goldberg, and I was a little concerned, you know, because I'd never seen that before. And when I walked into the office, you know, the staff was very calm and reassuring, and Dr. Goldberg, as he always has been for all these years, going back to 1979, was just very calm and reassuring, but there was something a little different about him this time. And so, Dr. Goldberg, you have my permission to talk about my case. What did you find?
Well, your symptoms say a lot. You know, when you see those flashing lights and it's new and sudden and wasn't there the day before, you know, it's quite indicative that there could be something wrong with the retina. So we dilated your eyes. We did a retinal image test, which is very helpful for me to see what's going on. And indeed, we were able to spot something. And then we know we don't waste any time, because we sent you the same day, right?
Right.
Yeah.
That's right.
And because if you wait, it can turn into a much greater problem.
Right. And even with him telling me that, he thought that we were going to go and I needed to see a specialist, there was still a calmness about you. I mean, I knew, okay, something's going on, but the doctor's not freaking out. I mean, he's not really freaking out. He didn't tell me that I was going blind today, you know. So I got right on the phone and called to the retinal group, and the next day, I think it maybe was 2 days because it was on a weekend, so I think it was the next week that I went to see Dr. Melamud, and I was so impressed with the office staff that you have there. I mean, they were just fantastic. Because I had over the weekend to think about it, so I was a little bit more nervous by Monday morning. And very calming, very reassuring, and then you come in and I meet you and get the same thing. What did you find? And you have my permission to talk about my case.
Well, first of all, I have to thank Dr. Goldberg for referring you in the first place and for being the front line, so to speak, to recognize the symptoms of a retinal problem and to do a thorough and careful examination and to refer you for further treatment. The symptoms that you were having are actually not unusual. They were symptoms of flashes and floaters, which are symptoms that actually many people get. They are signifying changes in the eye, in the back of the eye, in the vitreous, in the retina. And in most cases, people with these symptoms don't have a serious problem. But in a small percentage of cases, as in your case, flashes and floaters can mean that you have a retinal tear. And in your case, after careful examination, I noted that you had a tear in your eye, a retinal tear in your eye. And at that point, I discussed with you the possible consequences of having a retinal tear and developing a more serious problem, which is a retinal detachment. And the retinal detachment is a potentially blinding condition.
I was getting nervous by that time. I started getting nervous when they started telling me that. So please continue.
Yeah, so exactly. And so a retinal detachment is a potentially blinding condition. And so a lot of my job is to explain to you very carefully what needs to be done to prevent that from happening. A retina is, and I explained very simply, it's like the eye is like a camera, and the retina is like the film in the camera. And the retina needs to be positioned in the back part of the eye. It's like a thin layer, like wallpaper, that lines the back part of the eye here. When a hole or a tear develops in the retina, that allows fluid from the inside of the eye to get behind the retinal tissue, and like wallpaper, it allows the retina to slowly detach or pull away from the back wall of the eye. If the retina is not attached to the back wall of the eye, just like if the film is not in the right place when you're taking a picture with a camera, the image is not going to come out clear.
Right.
So what I noted was that you had a tear in the retina, and at that point I advised that we should perform a laser surgical procedure to seal that tear before it turned into a bigger problem, the retinal detachment.
Right. And what impressed me, folks, you know, I thought he was telling me this, and my mind was just going to oh my, you know, I'm going blind, and oh, what am I going to do? And I'm going to have to take off from work, and I'm going to have to do this and do that. And then the doctor, he said, we're going to take care of this right now. I was I thought, this is so cool. I mean, you know, what can you do? You know, we can have surgery right now. My parents, my mother and my sister were with me, and they had no idea that this was going on. They just thought that I was just having a second opinion, you know, so to speak. So tell them what happened after that.
So the way we fix the retina, actually, you know what, if I could show on a piece of tissue.
Oh, sure.
This is actually what I use with a lot of my patients to show them.
I knew this would be good for something.
Yeah, this is how I use to show what a retinal tear and a retinal detachment is. So the retina is very thin, just like tissue paper. And what happens is there's a vitreous gel inside the eye. That gel can pull on the retina, creating the sensation of flashes, and create a tear or a hole that like a little flap that gapes in the retina. And what I did in your case, you had a flap tear. What I did in your case is using a laser, I spot welded around the retinal tear. I created little hot spots around the tear, and it essentially creates a barrier that welds the retina down, holds it in place so that the tear doesn't extend or doesn't get any bigger and doesn't turn into a retinal detachment.
Wow. Now, let's say if it had turned into a retinal detachment, what would the next steps have been?
So if it turns into a retinal detachment and the whole layer of the retina separates from the back wall of the eye, at that point, it becomes a situation that can't be fixed in an office. We then go to the hospital where, under anesthesia, you would need a surgery to fix the retinal detachment. During the surgery, we would drain fluid from under the retina, put your retina back in its proper place, and fill your eye with a gas bubble. And the gas bubble will help to hold the retina in place while it's healing. After the surgery, typically we ask patients to position, whether face down or on their side, for several days and up to a week in order to allow the retina to heal.
Wow.
So it's a big surgery.
That's a pretty serious surgery.
It's a big
right.
deal.
Right.
Yeah.
Well, we're going to take a short station break, and we'll be right back with Dr. Alexander Melamud and Dr. David Goldberg. So don't touch that dial. We'll be right back.
You'd think it would be easy to tell which kids have trouble with their eyesight.
Here, kitty, kitty. Here, kitty, kitty.
But that's not always the case. Even though 1 in 4 children may have a vision problem, eye doctors tell us the symptoms aren't always so obvious. For clues on how to spot the real-life signs of childhood vision problems, visit checkyearly.com, a public service message from the Vision Council of America, and reading is fundamental.
Welcome back, and you're watching Rock Your Block, and our special guests, Dr. David Goldberg and Dr. Alexander Melamud. Today's topic focuses on caring for one of our most prized possessions, our eyesight. So, Dr. Goldberg, let me go to you now. How many, on an average of a year, how many patients do you get to see that have this kind of problem, where you have to refer them? And is this age? I don't want to tell my age. You don't have to tell them that. But is this age specific, or could this happen to anyone?
Age is a factor. As people get older, there is definitely more pathology, more eye disease, and is a common condition called a vitreous detachment, which will happen roughly 55, 60 years old, where the vitreous will separate, and sometimes there are complications from that. So we see quite a few of those.
Right.
But as far as tears, detachments, half a dozen a year, maybe.
Right. Well, when you looked into my eyes, did you actually see a tear, or is there something else, or is it a discoloration, or what?
No, you can see the defect, and you especially see the defect best with the retinal image.
Okay, so those images are really
those
critical.
are really helpful.
That's really helpful. I see that you've brought something too. What is that?
Well, I brought an eye model similar to what we have here.
Mm-hmm.
So I can explain what we mostly do,
Okay.
where Dr. Melamud was talking about how the film of the eye is the retina, and it has to be in focus. Many eyes, the light comes from the front and does not focus on the retina. And that's why people have blurry vision. It could be nearsightedness, farsightedness, astigmatism. And so what we need to do is put a lens in the front, whether it's eyeglasses or contacts that'll sit on this front part, which is the cornea, to change the direction of light to focus clearly on the retina. So you have sharp vision.
Okay. Wow. That's really something. Well, I know that there are probably many diseases of the eye or problems. Can you just kind of go through, the both of you take turns and kind of go through some of the things that our viewers should be thinking about or should be cognizant of? I felt so bad when this happened because the first thing I thought about was I didn't go to my annual eye checkup.
Right.
And so I don't think I'll be doing that anymore. I think I'll be, making sure that we just kind of take our eyesight for granted.
Well, you do,
not
and
having any
many people
problems.
take the health for granted, not just
Right.
the eyes,
Yeah,
until
that's
something
true.
goes wrong. But in terms of common conditions, this is the lens of the eye.
Mm-hmm.
This is the part that will develop a cataract, usually as people age, very common when you reach your 70s.
And what is a cataract?
A cataract, this is the lens of the eye that needs to be clear because the light again has to pass through to get to the back. And the lens will just start to become cloudy, opaque, and it will blur your vision, and it will scatter the light. You'll see a lot of glare, and it just is progressive. It's usually gradual. But is it true cataract surgery is one of the most common surgeries there is,
Really?
right?
It is. Cataract formation is almost universal.
Really?
Yeah.
Are they visible with the natural eye, or do you have to be able to see it in the imaging? Okay.
Well, can you see it in the
Can
mirror?
I
you
look
mean?
at a person and say, oh, that
No.
person's got cataracts?
No.
Well, if it's very, very dense, but
Okay.
nowadays, no.
Yeah.
You can. Okay.
No.
Okay. So you're saying that and I know my mother recently had cataract surgery, and she's 89 years old.
Yes.
And the amazing thing was that when she went back for her checkup, we thought that she would need, glasses.
Right.
She had 20/20, so she didn't need any glasses.
No, it's true. People who've had strong glasses, they have the cataract removed, and now they can see without glasses for first time since they were little kids.
Right. She's seeing better than those kids. So what are some of the other types of eye diseases?
You want to go?
Just to focus, I'll stick to the retina because
Okay.
there's enough diseases there to fill
Wow.
up the program, so to speak. But I think the most common thing, and now with the baby boomer generation sort of getting into the age category where some of these retinal diseases come into play, age-related macular degeneration is something that viewers should be aware of. It's a very common condition. It has to do with degeneration, aging of the retina over time. It's typically hereditary, although certain things like smoking, diet, sunlight exposure do have an effect on the health of the eye and the aging of the eye.
Diet?
Even
Really?
diet. And believe it or not, one of the treatments for age-related macular degeneration is vitamin supplements.
Really?
So we think
didn't
that
know that.
vitamins are just,
Right.
don't do anything, but they really do. And there's been many, many studies that show that high doses of vitamins. Now, I'll just caution and say that vitamins are not for everyone, and you really should have an eye care professional examine your eyes to determine whether you'd be a candidate for that. But vitamins for age-related macular degeneration do slow down the progression of this disease and do prevent worsening of vision over time.
Are there certain type of foods that we should not be eating? I mean, I noticed that when both of you came in, I offered you hot chocolate with cocoa, I mean, with whipped cream on top of it, and coffee, and they both wanted water. So I'm thinking, okay.
Yeah. Two doctors right there. Yeah.
So are there certain type of foods that we should be cautious of?
Well, the same foods for your general health that are
Really?
not good for you, whether it's mostly fatty foods.
Yeah, a lot of dairy.
Yeah, so the dark green vegetables, the fish, all that is recommended.
Fruit.
Mm-hmm.
Right, you heard that, folks.
What's heart healthy is generally eye healthy as well.
Okay,
So
all
heart
right.
healthy diet is always good for the eyes as well.
Okay, good. And then you both said there are more, more disease. What about children? A lot of times, I was speaking with a mother not so long ago, and her child is about 10 years old and has never been to an eye doctor, and she thinks that she can self-diagnose her, and I'm thinking, gosh, that kid should have gone to a doctor when they were starting school, maybe even. So what advice would you give to people about that?
Well, there's a
for
common
children?
condition that children have called lazy eye or amblyopia.
Okay.
And that's where one eye is not developed. And the brain favors the good eye, and so the weaker eye does not develop. And unless that's caught at an early age, that eye will never see well, or never
Really?
see as well as it should. And
Is that
because
from
it's
the
just
eye
one
droops?
eye,
Is that the droopy?
no,
is that
sometimes
what-
it goes along with eyes that will cross or not straight,
Oh, okay.
but not always. So you don't know you have it. And that's why all children should be screened. In fact, there's a movement in the country now to require eye exams for young children
Right.
before school.
Wow.
Yeah, it's very important to realize that there's a brain-eye connection, and in young kids, the brain and the eye are learning to work together. And if the eye is not, if the camera unit, if the eye is not functioning, if it's not focusing, or if the two eyes are not working together and one eye veers out, then that brain-eye connection will never really fully get established. It needs to be established by about, at the latest, age 8, 9, 10 years old. If vision is not corrected in kids by that age, it may never get established.
Oh, wow.
So,
That could be
yeah.
pretty serious.
So it is important to screen kids
Right,
for that.
right.
Yeah.
Well, what about blindness? I know when I was coming up, I mean, that was happening a lot. And I just wondered if there have been technological advances, say, over the past 40 or 50 years that have helped to control or correct people who would otherwise be blind.
There have been. Glaucoma is a big disease. And again, glaucoma is a disease that people are not aware they have. There's no pain. You can read the bottom line of the eye chart because you're slowly losing your peripheral vision. So even though you feel like you see well and you're not experiencing any problems with the eyes, that's an important reason to get your eyes examined.
Right, right.
Another one, and again, you can explain better than I can, is what diabetes can do to the eyes.
Diabetes?
Mm-hmm.
That affects the eyes?
Diabetes
I didn't
does
realize that.
in many different ways, just like it affects many other parts of the body. High blood sugars tend to damage blood vessels, and in the eye, it's in the retina that we typically see the damage. And so diabetics can very much lose their vision and need to be screened annually for signs of diabetic retinopathy.
Wow.
And there are a lot of treatments, including laser treatments and more recently injections of medications into the eye that help diabetics to continue to enjoy good vision.
Right. Well, as I said earlier, I knew that I wouldn't get to the 50 questions that I have here for the doctors. I'd like to ask if you guys would come back at some other time and just, share with us about, because I've learned a lot myself here today. We have just a few more minutes, but before we end, I would like to talk about your wonderful staffs. I'd like you to talk a little bit about your offices. I've been going to Dr. Goldberg forever, and just always had such an outstanding staff.
Well, thank you.
I've never been to the other office, but can you just say a word, something good about your staff? And I'd like Dr. Melamud to follow up with that.
Well, as I mentioned before, there were 3 women at my office, and we've all been together for 30 years,
Yeah.
which, you know, says a lot. I think that's unusual. I'm
Yeah.
quite proud of
true.
that.
What are their names?
Lisa Howerton, Eva Joza, and Michelle Roethlisberger.
Yes,
In
they
fact, 2 of them left for a couple years and came back.
are. Right. See, that shows you what a great boss he is. Dr. Melamud.
I'm very proud of our group. As I said, we're the largest group in the country, but I don't think that really says everything. I think the wonderful staff and the care they provide, and we really provide a local service, even though we have 23 doctors all around the Beltway.
Wow.
For me, the beauty of being in a large group is just the ability to have a lot of colleagues to share with, and certainly our patients are a testament to the fact that that our staff does a wonderful job.
Thank you. Well, we appreciate Drs. Goldberg and Melamud educating us on the proper care of our eyes. I'm hoping that we will, you know, that they're going to come back for more information at a later time. Most of us take our eyesight for granted. I believe that this is a wonderful gift from God, and we need to do a better job in caring for our eyes.